Kim Gandy, founder and CEO of Play-ItHealth. I was previously a pediatric heart and transplant surgeon, and in that field, we had a big problem, for we could perform the Hail Mary of transplants, but still lose patients if they failed to follow their prescribed regimens or didn't take their medications. And I wish I could tell you that this particular problem was limited to transplant, but it's not. As you all know, there are 150 million people in the United States on chronic medications, and over half of these are non-adherent with their prescribed regimens. This is a process that results in 125,000 deaths annually per CDC data and over $300 billion in losses annually. The WHO states that improving adherence to prescribed regimens can be one of the most impactful things we can do to improve outcomes in healthcare, not only in the United States, but globally. So we have leveraged 25 years of experience in the trenches, where we were trying to understand what made patients adhere to their regimens and what made them not, and created a platform called Planet Med that makes following a health regimen more understandable and enjoyable. Because we're aware and data show that if we're able to do that, we will improve outcomes. And I want to leave you with another thought about why adherence is so important. Most of the regimens that we follow on a chronic basis, that long-term data has been obtained by assuming that patients are adherent to their prescribed regimens. Well, we know that's not true. We know that adherence has really only been somewhere around 50%. That being the case, step one that we need to do, and one of the most impactful things that we can do to improve outcomes, is to actually understand what that adherence level is. Without that data, it is really hard for us to move forward. So I have been an instructor at both Duke and Stanford and have had the privilege of being on a lot of rock star teams. But what I can tell you is that the team that I am currently on is more positioned to change healthcare than any of the ones that I have been on previously. So I've been recognized as one of the nation's top doctors. I have been on international committees that set the path for translational research for the future. And we have team members that have taken products from conception successfully into the market, and team members that have designed and exited EHR companies. And with that team, we have designed a one-of-a-kind solution that brings together all the elements of a healthcare regimen. So our system is a HIPAA-compliant mobile platform that provides tailored reminders, personalized educational content in a way not out there on the market, and a rich reward system. We track within that system education to personalized educational pearls that we push out on a daily basis, appointments, use of any of these linked devices, such as many of the beautiful ones that have been described today, medications, and recently we have added in nutrition into that whole platform. We take that data, we churn it through what we call condition-specific algorithms. In other words, it's different for rheumatology than it is for transplant, and we generate our proprietary score called the PALM score, which can then be used to incentivize and motivate patients. We think that is a game changer, not only because of the way that we have created that solution, but because it interfaces with so many other data sets. And this was one of our goals from the beginning. So we are interfacing with multiple HIEs and with multiple other data sets from other startups and other partners. We're distinguished by both our proprietary scoring engine, which wonderfully fits into existing clinical workflows. So in other words, we're not asking clinicians to do something different, which is a big thing with the way this whole scoring system was designed. And the fact that we're able to bring in all the elements of a complete regimen and hit over 20 different chronic conditions. We have data from a pilot that was performed at Duke where our solution was recognized by clinicians and patients alike for its usability and likability. And we have been recognized within the community by our traction. So we have over 14 pilots in design or execution with major institutions, many of those hospital systems giving us access to 4% of the patient market currently. We have 3 paying customers, so we're beyond the sort of paid pilot sort of phase. We have recurring revenue, and we currently have interfaced with both hospitals and pharmacies. And I can't emphasize enough how we are in the right place at the right time with the right solution. Just 2 weeks before the end of the year, a new code came out that gave us the ability, or gave one the ability to have reimbursement for remote patient monitoring. Well, that's a game changer for us. Because though we would like to believe that people would like to use our solution and improve adherence for improving outcomes, we all know that in the real world, adding some reimbursement and aligning incentives to that really changes the game. So please join us now on our goal towards moving forward in healthcare. I could not be more privileged to be as part of this organization and having the ability to interface with multiple transformers and groups such as yourselves, already interfacing with some of the startups that have been on the stage this morning. There are 125,000 patients dying each year in the United States from non-adherence. And there are hundreds of thousands more that have their lives irrevocably damaged by this same disease. Thank you very much.